Compared with my last video on COVID-19, this one will update you and give you a new outlook. My name is April Lota, and I will explain in this video the status quo in the Philippines, the vaccine projects that are right now in development, and the chances of success, as well as what we personally can do to keep the numbers of infections low. We will also learn about the new tests available. Here in the Philippines, we are much better off than many other countries. We have a lot less deaths in relation to our population. Of course, we also have a lot of lockdown damages which affects everyone. As stressed in the first video, we all have to avoid the so-called super spreading scenarios like indoor parties and all events where many people gather with no real social distancing. This applies unfortunately also to churches, sports events, concerts, and the likes. We have to detect and break the chain of infections. We have to contain the virus through quarantining the infected and their contacts. We need to test and expand contact tracing, period. And all others should carry on. We can't paralyze the public life. If we are not able to do that, we will come back where we stand in April. What do we need to know about the tests? Here are different approaches to the tests. First, make regular PCR tests faster. Faster tests are already approved or in progress. A new test manages more than 4,000 tests in a 24-hour operation. That is far above the previous capacities. The real-time PCR test, or the polymerase chain reaction, is the confirmatory test. This test lags behind the actual infection situation. Meanwhile, we know the risk of infection is the greatest before we even experience symptoms. Second, rapid antibody tests. They are not suitable for the early detection of an infection because you do not look for the pathogens themselves but for antibodies. However, the immune system only generates them after a week or even later. Rapid antibody tests can only indicate an infection at an advanced stage when one is usually hardly infectious anymore. These tests do not detect the virus itself, but whether you have antibodies against the virus in your blood. This is the case if you already had the disease, even you might have had no symptoms. Some of the tests give results within 10 minutes, and these tests are like a proof of immunity. No test is perfect. There will always be false results like falsely positive or falsely negative. They are not 100% reliable. Third, rapid antigen tests. They test for antigens, for example, components of the virus. They detect a surface protein with which the virus penetrates the cells. They work in a similar way to a pregnancy test. They are quick, very cheap, and easy to use. Compared to the gold standard PCR tests, the rapid antigen tests are much less reliable. On average, they only detect half of all people with COVID. But the more infectious you are, the more precise they become. Rapid antigen tests in particular could therefore help to find infected people earlier. The reason? From studies, you know that you have the highest viral load before you even notice anything about the disease. It is precisely then that you can easily infect other people, even if you feel healthy. This way, you don't lose any time. Antigen testing doesn't solve all problems. One thing must be clear. A negative test result with a rapid antigen test does not mean that you are not infected. However, it means that there is a high probability that you will not infect anyone on this day because the test is more accurate when you are particularly infectious. The introduction of rapid tests is currently being discussed in the Philippines. However, they will probably only be available in sufficient numbers in the middle of 2021. The gold standard PCR tests usually only tests after you have noticed symptoms, at a time when the viral load has often decreased again. Until then, a lot of time has passed in which you could infect others. Rapid antigen tests could therefore be useful, especially where a fast result is of the essence. The PCR test is more accurate, but it takes time for the result to be transmitted, long enough that the people can continue infecting others. The rapid antigen test is less accurate, but if positive, you know immediately. In other words, the rapid antigen tests increase the chance of finding precisely those people who would otherwise have unknowingly infected other people. Regular, inexpensive, quick tests could therefore be much more useful for schools than occasional expensive PCR tests. ID Now tests. The test results are available in minutes. This test was initially not recommended by the US FDA because of accuracy concerns. But today, we know that this test shows false negative results only when the viral load falls below a certain value. But samples with a high viral load are very likely to be correctly positive. The higher the viral load, the more contagious one is. So, these tests help to detect people with a high viral load. To make things clear, COVID-19 is the disease from the new severe acute respiratory syndrome coronavirus 2. There are different COVID-19 scenarios and predictions. The disease will certainly be with us in 2021 and longer. Temporary local lockdowns are the new normal. Even an approved vaccine will protect against the infection only for circa 6 months. Many rich countries have already contractually secured larger quantities of the vaccines that are being developed. But more on the development of the vaccines a bit later in the video. At this point in time, we are approaching 30 million cases worldwide and 1 million deaths worldwide. In the Philippines, we have 270,000 cases and 4,700 deaths. COVID-19 will stay with us. The progress of the epidemic largely depends on factors that are as yet unknown. We do not know yet whether people will become permanently immune to the pathogen or whether those who have already been cured will be reinfected. A few proven cases in Hong Kong and Nevada are making the situation worse. The decisions of the government are an essential variant. In some countries, measures are being relaxed, in others not. Changes in behavior can reduce the spread of the virus if people stick to them. The pandemic is not the same everywhere in the world. For example, in countries like New Zealand, China, Korea, and Taiwan, the numbers were drastically reduced during lockdowns. However, when the measures were relaxed, there was a renewed flare-up. On the other hand, in countries such as the USA, Brazil, Mexico, and the UK, the infections have increased rapidly because the governments did not properly implement the measures or never actually implemented them nationwide. In the latter group are also countries like South Africa, where there are now 650,000 active cases. In terms of hospital resources, the country has reached its capacity limit. And now some good news. There are indications that people largely follow hygiene measures such as hand washing, wearing masks and face shields that help to contain the epidemic. In many countries, infections have not increased as much as expected based on previous data. The best strategy against the pandemic is to adequately test, isolate new cases, and track the contacts. The decisive factor is the rapid identification of contacts. To get an outbreak under control, almost all contacts have to be identified within a few days. The lists in the restaurants with the contact details, for example, also play a role in our containment efforts. Of course, if there are thousands of new infections in a small area, this task is almost impossible. In addition, the actual number of cases is much higher than the officially published numbers. According to experts, the coming winter season, especially in Europe and North America, will show an increase in transmissions. This can be inferred from the seasonal fluctuations of many cold viruses such as influenza and other coronaviruses, which lead to outbreaks in winter. Dry air promotes the transmission of respiratory viruses. Research shows us that there is still a long way to go. To end the pandemic, the pathogen must either be eradicated worldwide, which is practically impossible, or people build up adequate immunity through infections or vaccines. In order to achieve this immunity of at least 60%, we have to prepare for this long road. Now let's talk about the vaccine. A vaccine is the only way to end the pandemic in a relatively short time. It's estimated that there are about 200 vaccine projects currently in development. Most of them are not yet in human trial. What are then the chances of success? Only some of the developers have enough funding. Different countries have invested large sums in projects. none of which can judge whether an effective vaccine will ultimately be available. For the first time, new paths are used with RNA and DNA technology in the development of vaccines. Some countries will find it difficult to have access to successful vaccines. Hopefully, the Philippines is not in that group. The first to be vaccinated according to plan will be the high-risk groups, healthcare workers, the elderly, and other risk groups. Over 7 billion people live on this earth. Vaccinating billions of people is a daunting task. Not only the vaccine is needed, billions of syringes and vials too. Tremendous logistics problems have to be overcome. Some countries will certainly prefer their own citizens first. This pandemic is definitely a global issue. Hopefully, political problems between different countries will not hinder or slow down the development. We not only need vaccines but therapeutics, support diagnostics, and personal protective equipment. Finally, each of us contributes to the infection process for better or for worse. That means through our daily behavior, we can influence the outcome of the pandemic. Even if our government is in a difficult situation to keep the economy running, the social distancing rule should not be compromised. 50 centimeters or even less, as planned by the Department of Transportation, will not help to contain the pandemic. Thank you.